Everyone, welcome to my theatre. In this movie, we will be learning about the investigations that is done in the retina to know about various disease process. Okay, so what are the investigation that we do in the retina? Broadly, the investigation we can divide them into 4 parts. First is the investigations that are done to see the 10 layers of the retina. Second is the investigation to know about the blood vessels, how the blood flows inside the retina. Third is the set of investigations which help us to know the electrical activity. And fourth is the set of investigation which help us to know how the macula functions, that is the macular function tests. So we'll be dividing it into 4 parts and we will be discussing each of them separately. First, let us move on to the retinal layers. Well, how do we know about the retinal layers? Is there something which can help us to see all the 10 layers of the retina without any invasion? Yes, it's the optical coherence tomography, or known as OCT. OCT is a machine which helps us to appreciate all the 10 layers of the retina. Basically, it uses light waves and it is a non-invasive technique. So it's a very popular technique. Now I will tell you how to appreciate and interpret an OCT. Well, here I will be giving you some tricks to make it easy for you. Okay, so be careful, listen to me carefully. The first trick is there that in the entire OCT you will see 4 white lines. Okay, you will be seeing 4 white lines. Remember, the first white line will be at the top, which is the nerve fiber layer. The second white line which you see will be at the here, this one at the bottom, that is the photoreceptor layer. The third white line which you see is the retinal pigment epithelium, and the fourth white line is the Bruch's membrane. Fine, 4 white lines, and in this Bruch's membrane is a part of choroid. So, but the rest 3, the nerve fiber layer, the photoreceptors, and the retinal pigment epithelium, they are 3 layers of the choroid of the retina. So we are done with 3 layers of the retina. Now let's learn how to know the other layers. Now trick number 2. Trick number 2 is that you will see the 3 dark lines where 2 dark layers will be more dark and the third dark layer will be slightly lesser dark. So what are those dark layers? You can see this is a dark layer. This layer is, the entire layer is dark. This is the second dark layer, and this is the third dark layer which is comparatively less dark. So what are those dark layers? They are the nuclear layers. The nuclear layers will be dark in the optical coherence tomography. So obviously this is the outer nuclear layer, this is the inner nuclear layer, and this is the ganglion cell layer, because ganglion cell also has a nuclei. So the third one is the ganglion cell layer. Fine. So now we are done with 6 layers of OCT. Left with 4. Next, trick number 3. Obviously, any layer which is present between the nuclear layer has to be plexiform layer. Fine. So this is the outer nuclear and this is the inner nuclear. So naturally this white zone is going to be outer plexiform and this white zone is going to be inner plexiform. So now we are done with 8 layers and left with 2 layers. What are those 2 layers? The inner limiting membrane and the outer limiting membrane. So how do we appreciate that? Okay, do you see a very thin line here? The thin line just above the photoreceptor, the thin line. This is nothing but the outer limiting membrane, and the thin line which actually it's very difficult to appreciate, but the thin line which is present near the vitreous is the internal limiting membrane. Fine. So to repeat, there are 10 layers in the OCT, and the trick to appreciate it is first knowing that there are 4 layers which will appear white. They are the nerve fiber layer, the photoreceptor, the retinal pigment epithelium, and the Bruch's. but Brooks is a part of choroid. So we can there are 3 layers in the retina which appear white and 1 of the choroid. Now tip number 2, there are 3 dark layers which are the nuclear layers, the outer nuclear, the inner nuclear and the ganglion cell layer. Tip number 3, the layers in between the nuclear layer which appear slightly less dark are the plexiform layer, which is the outer plexiform and the inner plexiform. And tip number 4, we see a thin line just above the which is just above the photoreceptors and a thin line near the vitreous, and they are the inner limiting membrane and the outer limiting membrane. This is how we appreciate the 10 layers of the OCT with some trick. Well, what are the layers that we see? What are the things that we see in a OCT? From this picture, you can very clearly say that we can see the posterior part of the vitreous cavity, because this is the vitreous. We don't see the entire vitreous, but we definitely see the posterior part of the vitreous cavity. And of course, all the 10 layers of the retina and the choroid, which we usually see in enhanced depth OCT. 3. The 4th is the optic nerve. So these are the things that we see in OCT. But remember, we see the central fundus. We don't see the peripheral fundus in an optical coherence tomography. Fine. So now I will show you an animated video which will help you to appreciate the layers even better. So let's have a look. See. So this is the vitreous cavity, and we know that the inner 9 layers are the neurosensory retina and the outer 1 layer is the retinal pigment epithelium. So here it is showing the inner 9 layers, that is the neurosensory retina. All the 9 layers are shown here. Now the layer which is the outermost is the retinal pigment epithelium. So here it's showing the retinal pigment epithelium and the Brooks membrane together. So this is the retinal pigment epithelium along with the Brooks membrane. Okay. Now this is the vitreous and this is the choroid side, and this is the optic nerve. So now this is the choroid. In the choroid, since choroid has a rich vascular supply, we can see a lot of puffy cut end of the vessels. I mean, they will look like puffy balls. So they are all the cut end of the vessels, and this is the choroid. Fine. Now here we see a depression, and this is nothing but the optic nerve. The retinal nerve fiber layers, they form the optic nerve and exit the eye at this place. And why is it depressed? Because of the optic curve. So basically, optic nerve, vitreous, neurosensory retina, pigment epithelium, and choroid. These are the things which we can see in a OCT. But remember, the central part, not the peripheral part. Now this is the posterior cortical vitreous. Well, the entire vitreous is not visible, but it's only the posterior part of the vitreous which is visible. And now, what is this layer? I have told you the first white layer, which is the innermost, is the nerve fiber layer. So this white layer is the nerve fiber layer. This was in my trick, right? That the innermost white layer is the nerve fiber layer. And then we will see the next layer. What is the next layer? The next layer is the ganglion cell layer. I have told you that ganglion cell layer is dark but comparatively less dark in comparison to the rest of the dark layers. So the next layer is going to be the ganglion cell layer. And I told you that in between the nuclear layer we always have the plexiform layers. Ganglion cell layer is also a kind of nuclear layer, but obviously it is named after the cell which is forming the nucleus. So naturally, after the cell layer we have the inner plexiform layer, which is formed by the ganglion cell and the inner nuclear. And in my trick, I told you that this dark layer is going to be the inner nuclear layer, and then the next layer, which is just after the inner nuclear layer, is going to be the outer plexiform layer, right? Because it will be formed by the inner nuclear layer and the outer nuclear layer. So naturally, this one is the outer plexiform layer. And then after the outer plexiform layer, what will we have? We will have the outer nuclear layer, which is also known as layer of Henle. The outer nuclear layer is also known as the layer of Henry. So the shape of this outer nuclear layer is a bit different. If you know the anatomy of macula, you will know why it is different, because the rest of the layers are not present in the fovea and foveola, but this is there. So the shape of it is like this. And then if you remember, I told you that there is a very thin line which you can appreciate, and that thin line is the external limiting membrane. We also have the internal limiting membrane, which is completely inside, and this thin line is the external limiting membrane. And now when it comes to the photoreceptor, I told you that this white layer is the photoreceptor. But photoreceptor you don't have to know, but just to tell you, photoreceptor has inner segment, outer segment, and the inner segment again has myoid zone and ellipsoid zone. So basically the innermost, which is the myoid zone, so it is showing all the zones of photoreceptors. But for you, you just have to know that this white layer is for photoreceptor. This is the inner segment myoid zone, and then the white one which I tell that it is photoreceptor, it is the inner segment, this is the inner segment ellipsoid zone of the photoreceptor. And just after it, we will have the outer segment of the photoreceptors. So basically it has shown the photoreceptor, it has divided the photoreceptor into inner segment, outer segment, and then the inner segment being divided into the myoid and the ellipsoid zone. See, this is the outer segment. But for you, just remember what I have said, because that will help you for an easy interpretation. But if you can always go ahead with appreciating all the layers of the photoreceptors. And then I said, after the photoreceptor we have an interdigitation zone, and then we have the retinal pigment epithelium and the Brooks. Brooks is a part of choroid, but it's the retinal pigment epithelium which is a part of the retina. Fine. So yeah, this is the retinal pigment epithelium and the Brooks. It has been shown together. And then just after that we have the choroid. So this entire thing, which is usually seen in enhanced depth OCT, this thing like the cut and the end of the blood vessels and other things. So these are all the choriocapillaries. When we cut the capillaries, we basically see the lumen, the black one are the lumens, and the surrounding cells. The surrounding cells are usually white in color, and the lumen is usually black in color. So this is how we appreciate the choriocapillaries. So this shows, and then it also speaks about the saddler and the hollow layer of the choroid. So these are all the layers which you see in the OCT. Fine. Nerve fiber. Fine. So I hope with this you are very much clear, and you can appreciate the layers of the OCT very well with the help of the tips and tricks that I told you. As I said, that we see only the central part in the OCT, but we don't see the peripheral part, number one. And what are the structures that we see? We see the posterior part of the vitreous, the optic nerve, all the layers of the retina, and the choroid in enhanced depth OCT. Fine. So as I said, and now another thing is OCT is the investigation. Okay, first let's know the structures that we see in OCT. The structures that we see in OCT is, first is the posterior part of the posterior part of the vitreous, and then we see all the layers of the retina, and then the choroid in enhanced depth OCT, and then the optic nerve, and of course the macula. Because macula is the central part. And what we need to know is OCT helps us to see the central retina, and we can't see the peripheral retina in OCT. So to see the peripheral retina, we will have to do something else, okay? Peripheral retina is not visible in OCT. Now, OCT is the investigation of choice. Well, OCT can be done in any etiology where you have a doubt and where you want to see the central retina. But OCT is the investigation of choice in certain etiologies. So where is the OCT investigation of choice? It is the investigation of choice in macular edema and then macular hole, because we are seeing the macula we are trying to see the macula in detail, and then the central serous retinopathy, and then to measure the macular thickness and internal limiting membrane detachment. So these are the things where OCT is the preferred, but it's preferred in a lot of other etiologies as well, but these are the main things where OCT is preferred. Fine. So I hope I could explain you the OCT, to appreciate the layers of the OCT, and in the best possible way with some tips and tricks. And as I said, this is important for you for your exams. We will catch up in the next presentation with the pathologies which are with the ways to appreciate the blood flow in the retina. Okay, do like, share and subscribe and encourage me. Thank you.